The thought of an internal examination can be quite frightening for some, so I put this video together to just talk about what you can expect and hopefully make you feel a little bit more at ease. Firstly, you have to consent to having an internal examination, so this is something that you don't want to have. For whatever reason, you don't have to have one. You don't have to explain your reasoning for not wanting one, although it can be beneficial to talk about it because the reason might be something we can help you with. Within Sussex Community Foundation Trust, we do need written consent, but this is something we will go through during your appointment. If for whatever reason you do not want an internal examination, please do not feel that it isn't worth coming for physiotherapy because there are other treatment options we can offer you. If you'd like to bring a friend or relative with you, this is absolutely fine. We also have trained chaperones within the Trust that will be available to you if you would like. These will always be offered to you at every appointment, but if you know you would definitely like one present, then it's worth letting our admin team know when you book your appointment. Before any examination, you'll have spoken at length with your physiotherapist about your history of your symptoms. This may have been face-to-face or over the telephone. Your physio will explain why in your case it will be beneficial for you to have an internal examination. For the examination, you'll be asked to lie down on the plinth with your lower underwear removed. You will be given a towel to keep over you for modesty. The physio will wash their hands and place on an apron and gloves. Usually you're on your back with your knees bent, but sometimes we might examine you on your side if this is more comfortable for you. If there is a chaperone in the room, they will stay at your head end. The physio will examine you externally first and may get you to perform a pelvic floor exercise or bear down to see any prolapse symptoms. With your consent, they will then insert one gloved finger into your vagina with a bit of cold jelly for comfort. Gently, they will move their finger around to examine. Then, the physio will place their fingers gently on the pelvic floor muscles. The physio will explain how to exercise these muscles and you will work through some exercises to see how your pelvic floor is functioning. The examination should be comfortable and the physio will never push into pain. Depending on your symptoms, the physio may not do all that's just been explained, as this may not be appropriate for you. At any time, if you want to stop, you just say so. Depending on your symptoms, it may be more beneficial to do an anal examination. The examination is similar to the vaginal examination that I've just talked through, but we tend to lie you on your side to examine with a pillow between your knees. By examining your pelvic floor internally, we can give you a very specific exercise program based on our examination findings, and hopefully this will set you on the right path to start to improve your symptoms.